Hello, everyone. My name is Kylie Shaw. I'm an orthopedic surgery resident at CU, and along with my co-authors, this is our study, Pediatric Fracture Patterns During COVID. The purpose of our study was to identify how pediatric fracture trends were affected by the COVID-19 pandemic and associated stay-at-home and shelter-in-place orders. We also examined COVID-specific concerns, such as delays in care and rates of non-accidental trauma. To do this, we identified patients who presented to Children's for definitive management of a fracture between March 26th and May 31st of the years 2018, 2019, and 2020. These dates were selected as they represented the start of Colorado's first stay-at-home order through the end of a standard school year. We then collected data from these patients regarding patient demographics, injury mechanism and location, fracture characteristics, treatment, and number of days from injury to definitive treatment. Among the 1,838 patients who met inclusion criteria, we found that overall fracture numbers during the 2020 stay-at-home period decreased by 26% relative to 2019 and 23% relative to 2018. Overall, the distribution of demographics, treatment patterns, injury mechanisms, locations, and region were similar during the two control years of 2018 and 2019. Therefore, the two control periods were combined into a single control for all subsequent analyses. Demographically, we found that patients presenting during our study period in 2020 were significantly more likely to identify as white and speak English as their primary language. Patients in 2020 also tended to be significantly younger than the prior 2 years. In terms of injury and fracture data, we found that in 2020, unsurprisingly, injuries were more likely to occur in the home and involve trampolines, bikes, scooters, or skateboards. Also, unsurprisingly, we found a significant decrease in the odds of fracture occurring during organized sport compared to the prior 2 years, as many of these were canceled during this time as a result of the pandemic. Interestingly, overall, there was no significant difference in variables reflecting fracture severity, such as open fractures, multiple fractures, need for open reduction, or need for operative treatment. In terms of injury region, there was no significant difference in the rates of upper or lower extremity or axial skeleton fractures, and similar to prior years, the most commonly fractured bone was the radius. In 2020, however, there was an increase in both bone, forearm, or radius and ulna fractures. Interestingly, we found that when we stratified our data by age, there was significant heterogeneity in the magnitude of change in certain variables during 2020. These variables were occurrence of injury at home, bike or scooter-related injuries, and the need for operative treatment. While there was a significant increase in home and bike injuries among all ages in 2020, these injuries increased to a significantly greater degree in older subjects. The need for operative treatment, however, only significantly increased in 2020 for older subjects. This is seen in the data table for our 16-year-old patients, and again in these figures below, identifying temporal trends during our study dates in the years 2018, 2019, and 2020. In these figures, the x-axis represents time split into our 3-year intervals, and the y-axis represents the percent of fractures requiring operative treatment. The dashed line represents the median values across the time intervals in each year. In this case, older subjects were defined as those over 9.4 years old, as this value represents the 75th percentile for age among our study cohort. For our COVID-specific concerns, we found that there was a significant increase in the proportion of patients who underwent definitive treatment greater than 5 days after the initial injury during 2020. A delay was defined as greater than 5 days, as this represented the 75th percentile for our time from injury to definitive treatment. Interestingly, the relationship between delay and treatment did not differ between fractures treated operatively and those treated non-operatively. And as you can see in our figure, that again identifies temporal trends, now with the y-axis representing the percent of cases where care was delayed greater than 5 days, The proportion of patients who experienced delayed care increased substantially at the end of May 2020, which was the end of our study timeline. Turning to non-accidental trauma, as you can see in our temporal graphs, the increase in the odds of a pediatric fracture occurring secondary to non-accidental trauma increased substantially in 2020. However, because of the small sample size of NAT patients, the data was not statistically significant in our cohort alone. When we combine our results with those of a similar study by Kovler out of Baltimore in a meta-analysis, the forest plot on the left indicates that the overall effect reveals a strong and statistically significant increase in the occurrence of NAT during the 2020 stay-at-home period. In conclusion, despite overall lower rates of trauma during the first stay-at-home order of 2020, we did see a notable shift in pediatric fracture patterns. We saw a greater number of fractures seen in younger children. Older children were more likely to suffer an injury requiring operative treatment. And greater number of fractures were seen resulting from moderate to high energy mechanisms such as trampoline, scooter, skateboard, and bicycle accidents. In terms of COVID-specific questions, we did find that in 2020, a higher percentage of patients had more than a 5-day delay from injury to definitive care. And unfortunately, there are strong indications that instances of non-accidental trauma have become increasingly prevalent since the pandemic began. Although these results are multifactorial, as the pandemic and associated legislative orders continue to evolve, we as an orthopedic treatment center need to educate patients and guardians regarding activities with high risk for fracture. We need to be prepared to treat higher energy injuries resulting from trampolines and motorized vehicles. We have to anticipate delays in care, whether due to patient or hospital factors, and unfortunately continue to consider the possibility of non-accidental trauma in patients presenting for fracture treatment during the pandemic. And with that, I will thank you and I'll leave for questions. Thank you so much.